The World Health Organization has chosen Malaysia as one of the countries to run trials on the effectiveness of a drug called Remdesivir to treat COVID-19 patients. Meanwhile, Malaysia has also reported a spike of cases on Sunday, taking the total to more than 2,000, the highest in Southeast Asia. Also, the Malaysian minister is saying that their economy will need at least 6 months to recover now. We have more from our EBC correspondent in Malaysia, Ruby Tinawin. Ruby?
Yes.
Hi, Ruby. How are you?
Hi, Alma. So I'm here to report all these latest updates in Malaysia. Hundreds of people were arrested in Malaysia in the past weeks for violating restriction aimed at stemming the spread of coronavirus. The death toll rose from 27 to 34 within 24-hour period, the biggest daily rise so far, while the number of reported cases was up to 2,470, the highest in the Southeast Asia. Defense Minister Ismail Sabri Yaakob told reporter a total of 649 across the country have been arrested for various offenses, including loitering, gathering in groups, obstructing public officials, breaking through police blockades, and partying while the movement control order is in force. This was in addition to 614 people arrested since the movement curbs were imposed on March 18. Meanwhile, the Malaysian government expects the country's economy will need at least 6 months to recover after the COVID-19 crisis ends. Minister of Economic Affairs, Datuk Seri Mustafa Mohammed, said the estimated recovery period was reasonable with the support of the right strategies. He said several other COVID-19 affected countries may expect to take 9 months or more to rebuild their economies. He pointed out that various industries, including the tourism, hospitality, retail, and investment sectors, have been adversely affected by the COVID-19 outbreak. Meanwhile, he said the government was ready to discuss with the SMEs as well as micro-entrepreneurs who claim that they were left out of the people-centric economic stimulus package. The country has around 907,000 local entrepreneurs currently. And the good news, Malaysia has been chosen by the World Health Organization as one of the countries to run trials on the effectiveness of a drug called Remdesivir to treat COVID-19 patients, according to the National Security Council. It said Malaysia was chosen due to the ability of the Health Ministry to undertake the research. Health Director General Dr. Nur Hisham Abdullah said the ministry would treat COVID-19 patients with the new drug called Remdesivir and monitor all side effects and its efficacy. He explained that World Health Organization had announced last week a large global trial called Solidarity to find out whether any drugs could treat infections with the new coronavirus. The study, which could include many thousands of patients in dozens of countries, has been designed to be as simple as possible so that even hospitals overwhelmed by the onslaught of COVID-19 patients can participate. The focus are the four most promising therapies. One of that is the use of antiviral compound called Remdesivir. Malaysian Medical Association President Dr. Gana Baskaran said it was a great honor bestowed on Malaysia by the world's highest health body. A similar view was echoed by Malaysian Public Health Medicine Specialists Association President Dr. Zainal Omar, who said the selection was proof that the country has the ability to conduct tests and a good medical system, to be involved in the joint research to test drugs for COVID-19. Meanwhile, Health Minister Datuk Seri Dr. Adham Baba shared Malaysia's effort to address COVID-19 with health ministers around the world. In a teleconference with WHO Director General Dr. Tedros Adhanom Ghebreyesus on Friday night, he said the session on COVID-19 by World Health Organization provided the ministry with the opportunity to share information on the COVID-19 outbreak and measure that what are being taken to rectify all this problem, as well as the ministry's preparedness to handle the possibility of the infection becoming worse.
Okay,
Alma?
so Ruby, can you tell us more about this Remdesivir, this new trial that being given to Malaysia to run trials on the effectiveness of this? Can you tell us more about this?
Okay,
Uh,
Remdesivir is one of the oldest classes of antiviral drugs that goes under the acronym of RDV. And
okay.
this was an antiviral developed for Ebola.
Oh,
Laboratory tests suggest, earlier on, laboratory tests suggest Remdesivir is effective against a wide range of viruses, including SARS. So the
ah,
medication was pushed to treat the West African Ebola virus epidemic way back in 2013 to 2016. However, it failed to treat Ebola virus at that time when it was tested.
mm-hmm,
So for now, Remdesivir trial as of March 26, 2020,
mm-hmm,
there were 4 US trials, 2 China trials.
mm-hmm,
One Chinese trial is for severe COVID-19. One is for mild to moderate COVID-19. Now, the last day for data collection for the severe trial is April 3, while the last day for data collection for the mild to moderate one is April 10. So only after April 10, they will do the analysis and come up with a report whether or not Remdesivir is an effective antiviral drug for COVID-19.
mm-hmm.
Alma?
All right. Thank you very much, Ruby. Stay safe. Be healthy. Thank you for your
Yes,
time.
yes. Reporting from Malaysia here, EBC Malaysia Bureau, this is Ruby Tinawin. We live in interesting times.